Spirometry measures air going in and coming out as well as the ability to move large volumes of air quickly. It is typically the first test to indicate pulmonary disease. The test is effort dependent on the patient and they must be educated. Also, a minimum of 3 tests should be recorded and should not differ by more than 5% or 200 milliliters. The FVC is the most common and its results are based on the best out of 3 tests, which is determined by adding the FEV1 and FVC together to get highest value. This test should be given at least 4 to 8 hours after a SABA treatment and 12 hours after a LABA if applicable. 7 spirometry indications are to diagnose if there is lung disease, quantify the extent of the disease on lung function, measure the patient's job and environment exposure effects, determine the pros and cons of therapy, assess the risk of surgery, evaluate for disability or impairment, and for epidemiologic or clinical research on the lungs. 2 main spirometry measurements are the slow vital capacity or SVC, which is a maximal inspiration then a maximal exhalation without using force. A decreased VC is the best indicator for restrictive diseases. And there is the forced vital capacity or FVC, which is forcefully and rapidly expired volume after a maximum inspiration. The flow rates are used to identify obstructive diseases. Also, the exhale should be completed in 6 seconds. 5 measurements that can be found inside the SVC are the tidal volume or VT, which is the volume inspired in a normal breath. Its normal values are 500 to 700 milliliters. The inspiratory reserve volume or IRV, which is the amount you can inhale after a normal inspiration. Its normal value is 3.1 liters. The expiratory reserve volume or ERV, which is the amount you can exhale after a normal exhalation. Its normal value is 1.2 liters. The inspiratory capacity or IC, amount you can inhale after normal exhalation. Its normal value is 3.6 liters. The vital capacity or VC, amount you can exhale after maximal inhalation. Its normal value is 4.8 liters. 5 measurements that can be found inside the FVC are the FEV1, which is the maximal volume exhaled during the first second. The FEV1 to FVC ratio. This is found if you divide the largest FEV1 by largest FVC. Patient needs to obtain at least 70%, however it will be reduced with obstructive disease but normal with restrictive. The FEF 200 to 1200, which is the average flow during the first 1000 milliliters after 200 milliliters. It has a normal value of 6 liters per second. If decreased, it would reveal a large airway obstruction. The FEF 25 to 75%, which is the average flow during the middle of the FVC. It has a normal value of 4.7 liters per second. If decreased, it would reveal early stage small airway obstructive disease. And the PEFR, which is the maximal flow achieved during the FVC. It has a normal value of 10 liters per second. Here's a nice graph of some of the FVC components.